It's rolling. Okay. Hello. Our presentation is on improving language barriers in the healthcare setting. My name is Sierra.
I'm Melissa.
I'm Richard.
I'm Victoria.
I'm Kayla.
I'm Christian.
I'm Eliana.
I'm Jessica. Okay, so our background is that language barriers are impacting the communication between healthcare workers and the patients and affecting quality and safety of patient care. Patients with limited English proficiency face challenges understanding medical information, and it reduces their ability to be able to engage in their own care. Interpreter services and communication tools are used, but not consistently enough in the healthcare setting. Our problem is that inconsistent communication due to language barriers contributes to patient safety risks and gaps in their understanding of their medical care. Lack of consistent use of certified interpreters leads to a variability in care and unequal patient outcomes for the people who don't understand what you're saying. And there is a need for standardized, evidence-based communication practices to improve safety and ensure patient-centered care.
So the purpose of our presentation is to highlight how language barriers and healthcare directly impact patient safety. When communication breaks down, it can lead to serious errors in diagnosis, treatments, medication, instructions. These mistakes can result in poor outcomes and delay in care. But beyond that, language barriers also decrease patient trust and decrease patient outcomes, which contribute to healthcare disparities among diverse populations. However, by using clear evidence-based communication and professional interpreters, we can improve understanding, strengthen patient relationships, and promote health equity for all patients. So with that being said, we believe that participants should be able to identify when certified medical interpreters are required, list at least 2 patient safety risks related to language barriers, and describe how badge identifiers can improve communication and patient outcomes.
This project examines how language barriers can affect both patient safety and quality of care they are receiving, emphasizing the need for evidence-based communication strategies. Literature research was completed using databases such as Google Scholar as well as the Area Library, using peer-reviewed articles within these past 6 years. Search terms were searched that include interpreter services, culture competence, health disparities, safety, etc. Recent peer-reviewed studies were selected due to focusing on patient outcomes, safety, and communication in diverse healthcare settings. We also analyzed and identify common themes, such as the importance of interpreter use, improving patient understanding, and creating strategies to support patients who have limited English proficiency as well as not having no understanding of English in general in the United States of America.
Okay, so the literature review examined 20 articles that were peer-reviewed and found that there was an increased risk of miscommunication, delayed treatment, medication errors, and decreased patient satisfaction. Some major trends include increased use of professional services and technology. And so an example of this would be video remote interpreting. This is to improve communication as well as patient outcomes. A common method used to understand if the patient has a grasp on the information is the teach-back method. This is where the patient explains in their own words their understanding of the information topic, and this promotes safer care and as well as reduces disparities. And so the data shown here reflects across the articles that were peer-reviewed showed that with interpreting services, it had a higher percentage of positive patient outcomes rather than without interpreters.
So for Parsi's theory of human becoming, guided by Parsi's human becoming, this project emphasizes being present with patients and respecting their lived experiences by addressing language barriers. Effective communication helps nurses and patients build trust, co-create meaning, and also support informed decision-making through tools like certified medical interpreters. Improving communication promotes dignity, respects individual values, and also ensures care aligns with patients' beliefs. Language shapes meaning as individuals understand their experiences through communication, and advocating for interpreter services and identification systems support equitable and patient-centered care.
Faith really calls on the healthcare staff to practice on humility, justice, and Humility, justice, and compassion, as it helps to ensure that patients feel valued, that they're heard, and that they're understood. However, when there's language barriers present within the healthcare system, it can really hinder the mission of our ability to provide the best quality care that we can give. So then this in turn really leads to patients to experience emotional distress, confusion, and it disrupts our ability to get that respectful and compassionate care that we deserve. So that's why we really want to emphasize the ability of being able to address these language barriers very early on, which takes really a lifelong commitment. So a lot of time in patients are RN, but at the end it helps to promote dignity, it helps build trust, it helps us to better serve their needs. That's why in our verse, Philippians 2:4, it states, "Let each of you not look not only to his own interest, but also to the interest of others." And I think this really emphasizes the ability of us to be able to put ourselves in our patients' shoes, to really understand where they're coming from, especially during the most painful moments, and for us to be able to provide the best care that we can give and serve them.
For ethical and safety concerns, patients at risk for unsafe care and that misunderstanding. All patients have the right to informed consent and have access to information such as for instance, procedures and understanding procedures, what they're going to get done and all that. So as nurses, our job is to make sure that we're keeping that equitable care and we're able to advocate for that interpreter. So for example, using untrained interpreters, such as a family member or someone, it can possibly lead to confidentiality issues or even errors because they aren't properly trained in that field. On the other hand, trained interpreter helps keep that autonomy and dignity, and it helps overall improve the attendant care.
And then for implications for practice, this basically just what we can do as nurses or just the healthcare field in general to help improve patient care. So first off, just using medical interpreters. This really prevents miscommunication between the patient and the provider. It helps prevent any errors further on, as well as not relying on family members, or also if you speak the language but you're not very fluent, that can also lead to a further error because oftentimes there's different dialects between languages. And also as well as using the teach-back method and providing multilingual education materials. So oftentimes with medications, having them teach back what they're receiving, if they're fully aware of what they're getting, as well as when they're getting discharged. Oftentimes discharge paperwork could be very large, and if they have that language barrier, they may not be able to understand it, and that can lead to them not wanting to further seek out further health care and just a lack of trust, as well as improving our cultural competence. This helps provide us more individualized care for those diverse populations that we come across, and also using a standard language protocol. So basically making it consistent, a consistent use rather than be it chore or optional, and also just interpreting, using interpreter services from the admission to the discharge so that it's consistent and it helps prevent any further error, so that we can better understand our patients and prevent any further error.
And then for our conclusion, so addressing language barriers in the healthcare is very essential because it helps promote improve patient outcomes and then also improve safety and then informed consent. Providing professional interpreters and cultural competence training reduces disparities and then strengthens trust with patients and healthcare workers. And prioritizing language access upholds ethical principles and protects the dignity of every person.
And these are our references at the bottom right.
Thank you. I have to scan the QR.